This segment is sponsored by Reston Hospital. Low back pain is the leading cause of disability around the world, and it can affect anyone at any age. With World Spine Day coming up on October 16, spine surgeons affiliated with Reston Hospital Center are sharing their expert advice on how to keep your spine healthy, when it might be time to see a specialist, and the innovative new treatments helping patients get back to living pain-free. All right, here we are in the Spine Surgical Center area. What are some of the most common things that we do to hurt our back or to injure our spine?
You know, interesting, the majority of spinal issues are from just aging and degeneration, but injuries like twisting, lifting, abnormal posture, those are other kind of acute injuries that occur.
What are some of the most common things that people come here for needing treatment?
So the number one thing by far that we see as a spine specialist is back and neck pain and pinched nerves. When someone has pinched nerves, they oftentimes have pain in the shoulder blade all the way down their arms, or the classic sciatica would have buttocks pain and it goes all the way down their legs.
At what point would you advise someone you need to seek medical treatment? Some people just try and resolve it on their own, but when would they know that they need to come in?
Well, we tell people if it's just back and neck pain and it's tolerable, give it a couple of days, give it a couple of weeks. And if it's getting better with conservative stuff, with anti-inflammatories in time, most of the time it takes care of itself. Yeah. However, if there is any shooting pain down the arm, numbness, tingling, and mainly if there's any weakness, that's a big red flag. So if there's weakness of your arm, your hands, your function is deteriorated, and or your leg is weak, we need you to come in.
Can you share some of the surgical treatments and techniques that you have here at Reston Hospital?
I think we followed the full gambit of what patients need. So we want to make sure that at Reston we have everything capable that a patient with spine care would need. So it goes as small as a microdiscectomy, which is go in, take the acute compression of the nerve because you lifted something, pour away, and it's like an immediate sharp pain, or something like a bad degenerative back that after years and years of kind of wear and tear, you have stenosis multiple areas in the back and need an extensive surgery.
Non-surgically, the majority of the time we do physical therapy, and that generally works out best for most people. In fact, most people don't go beyond that. If that is not effective, you can do injections of different types. And if you fail both for physical therapy and non-operative care, then ultimately there are a bunch of different operations you may be a candidate for.
I know Reston Hospital is always innovating. Are there any up-and-coming technology that you're interested in for your patients?
I think more recently robotics has really kind of taken off, which allows us to do a lot of traditional operations much more efficiently through much smaller incisions, faster recovery, less complications.
We've been the forefront of robotic care for years. We were the first one to have the Renaissance robot, and later on became the Mazer robot. We have multiple robots here that have their own niche.
And when people come here looking for treatment, can you tell us a little bit about the team here and the experience they'll have?
Yeah, Reston Hospital is an amazing place to be for spine care and for orthopedic care. I've been here 20 years and I've seen a lot of changes, and I've seen so much development in both technology and personnel. The great things about Reston Hospital is the majority of the surgeries done here and the majority of work done here is focused on orthopedics and spine care. So be it the nursing staff, be it the physical therapist, be it the radiologist, the support care, so it creates a very nice place where everyone knows the patient from beginning to end and helps coordinate their care.
The focus on Reston has always been they took spine very seriously and wanted to make sure it's the most advanced care that the patients can get. So even when we talk about a minimally invasive surgery, we have kind of the most minimally invasive methods such as endoscopic spine that we could do in the right patient population, as well as the more complex patients where we're trying to do robotics and neuronavigation, so make sure we're completely accurate in our care that we're providing the patients.
Yeah. Well, we have a holiday in your honor. It's World Spine Day tomorrow. What words of wisdom or advice do you have for people to maintain a healthy spine?
I think the best way you can maintain a healthy spine is making sure you're overall healthy.
It's really important to get oxygen to your spine and other parts and your joints, so that's probably the number one thing.
The best way to take care of your spine is to take care of yourself. So people who do cardiovascular care, who take care of their body, same way you would take care of your heart and lungs, keep your weight down, exercise, get aerobic exercise in. That helps get blood supply to the spine, and that helps the discs, and that helps keep you young and healthy from a spine standpoint.
Yeah, great advice. Thank you.
You're welcome.
For more information, visit restonhospital.com, then click on Specialties and Spine Care.